Welcome back to the Caregivers podcast. I'm your host, Dr. Mark Ropoleski, and you can call me Dr. Mark. Before we begin today, please take a moment to subscribe or follow the Caregivers podcast wherever you're listening or watching. It's free and it really helps support the show. It helps these conversations reach more caregivers and families who are really trying to protect someone they love. When we think about caregiving, we often picture someone caring for a parent with dementia, a spouse with cancer, or a family member living with a serious illness. But addiction creates a different kind of caregiving. The person you love may lie to you, they may disappear, they may promise they're done and then relapse. They may need help and reject it all in the same conversation. And that could put families in a painful position, loving someone they can no longer fully trust. Somewhere inside all of that, the person trying to help starts living with impossible questions. Am I helping? Am I making this worse? If I say yes, am I enabling? If I say no, will I regret it for the rest of my life? Families are often told to set boundaries, stop enabling, detach with love, or let someone hit bottom. But those phrases can feel very different at 2 o'clock in the morning when your loved one is not called back and every part of you wants to do something. Our guest today is Dr. Nicole Kosanke. Nicole is a clinical psychologist and the clinical director of the Center for Motivation and Change and co-author of Beyond Addiction, How Science and Kindness Help People Change. But today, this is not a training episode about addiction management and treatment. This is a conversation about the people who love someone with addiction, the fear they carry, the broken trust they live with, the guilt they feel, the rescue patterns they get pulled into, the grief of losing someone who's still alive, and the possibility that you can love someone deeply without disappearing inside their illness. Nicole, welcome to the Caregivers podcast. Dr. Nicole Kosanke, welcome to the Caregivers podcast. We're so happy you're here to join us from New York City today.
Thanks so much for having me.
Well, in the tradition of the podcast, we like to jump right in, so let's do so. Nicole, can you tell us, when addiction enters a family, how does everyone else begin organizing their life around the person using, often before they even realize what they're actually doing?
Well, addiction doesn't pop into being sort of out of nowhere. There's usually quite a long period of time where things are getting worse, then better, worse, then better. There's sort of an evolution. And with that, the relationships among family members are also shifting and accommodating in ways that are not so helpful or sometimes helpful during periods. But it's usually quite gradual. And so people don't have necessarily an awareness that one thing is causing another thing. They're just sort of adapting to the circumstances. And oftentimes, if you have parents who have adult or teenage children who are experimenting, let's say, there can be an initial feeling of like, okay, maybe there's some normalcy to this. Maybe it's developmentally appropriate. Maybe pushing boundaries is part of growing up. And then if things get worse, and then over time, more and more problems are developing, then it sort of like impacts the family more and more. And so it evolves over time. But ultimately, if things really are developing into a problem, then you have everybody sort of being impacted.
What are the early signs then that the addiction has sort of decided what family and caregivers actually say or what they avoid, what they'll pay for, or how safe they feel in the home?
Yeah. So, I think the early signs are oftentimes partly about accommodation that feels maybe initially like I'm putting myself out in ways that feel like, okay, well, this person needs my help. And so I am the parent, so I'm going to go ahead and help them. And then if that feels more and more like it's encroaching upon normal functioning of the family, of my own well-being, if I feel like my boundaries are getting extended too far as a parent, that the asks of me to function more and more in ways that my child or adult child should be able to do for themselves, then those are signs that people are adapting to a substance problem that in not so healthy ways. But initially, of course, parents in particular are eager to help their kid. That's been their whole role, the child's whole life. So it makes a lot of sense initially. So it's not immediately apparent, nor is substance use disorder immediately apparent. It evolves over time.
So how's that different when the user is a spouse, for example?
Right. So, I mean, all of these different roles make a huge impact on how things roll out and how the roles get impacted. So, a parent and child, as I was just saying, like really, it's sort of inherent in the relationship. I, as a parent, am helping develop this person into a human being, and I have more responsibility to sort of guide them. Whereas I, as a spouse, expect that my spouse is going to be a peer with me and is going to help me as much as I help them. And there's some kind of equal back and forth about this. So when there is increasingly not a parity around who's responsible for what and what the roles are, then that can begin. Those are certainly early warning signs of this is not healthy. There is something really unhealthy going on here.
But, in many caregiving situations, we witness the illness and how it changes the person you love. But with addiction, the illness can also break trust. What happens to a caregiver when love and distrust have to live in the same relationship, in the same room?
Yeah, it can be very devastating and painful to care about someone that you can see is suffering, that you too are suffering, and there is often lying involved. There's often hiding. Um, and, a person with a substance use problem is often hiding from themselves as much as they're hiding from other people, trying to imagine that what is happening is normal. And to be fair, or I don't know if it's fair, but like to be clear about like the um societal role here. Like there are many groups of people that in which using substances, drinking heavily is the norm. And so, there may be a long history of thinking, okay, well, this is how my family does it. This is how my people do it. This is how my group of friends do it. And so it doesn't feel that different. Maybe it's causing more problems, but that'll probably go away. So there's a lot of sort of rationalizing depending on what the social environment is, depending on what the history is, and that can cause real problems in relationships when it feels like you're you're perceiving something that feels like off, but the person is saying, "No, I haven't been using," or "No, I haven't been drinking." And then you begin over time to realize like, "Wait a second. This is not what's happening. There's more to the situation that I suspected, but I didn't know for sure." So I think there can be a lot of divides in the relationship that is quite painful and evolves over time.
So, how does that broken trust change the way a caregiver listens, watches, checks, questions, reacts to the person they love?
Right. Right. I mean, exactly what you're saying, that there's a shift over time of the person using substances um, becoming less and less functional over time, and the person who cares about them, the caregiver, being more and more functional, like over functioning, doing more of the responsibilities, taking over. And sometimes this is a safety issue. The parent who is a caregiver is doing all the driving, is, picking the kids up, is doing more of the cooking or cleaning or what have you, because it seems like their partner is just like kind of falling off. And sometimes that is immediately apparent, that this in inequality of roles and responsibilities occurring. And sometimes it's not, because people go through waves of feeling like, okay, well, I'm doing this more now and the other person isn't. So I think that in general, that this over functioning of the caregiver is really hard on the caregiver, and is eventually a problem for the person using substances as well, because they have fewer and fewer responsibilities, and they're feeling more and more like their role in the family or in the relationship is becoming less and less important, and they feel less valued because they're not doing things that, it's nobody else's fault, but they're not doing things that would help them feel like essential and needed in the relationship.
So I just wanted to get back to one point because it really intrigues me. So before the addiction crisis, so to speak, that makes everything undeniable, many families live through like a long period of that suspicion and worry and making up of excuses and dealing with broken promises. What does that slow erosion actually do to the caregiver who feels something wrong, but they just can't fully name it?
Yeah. I mean, I think it makes people, the caregiver, less confident about their own perceptions. And sometimes it can increase the caregiver's feeling of support, certainly support from others, because they are feeling more and more alone. But if they're not able to trust their own perceptions, it's hard to ask for help around that. It's hard to identify what's really wrong if you are thinking, well, maybe this isn't really what I think it is, or what is it? Meanwhile, you have the entire culture around us emphasizing that this is kind of a moral problem, like this is a weakness. And there's such stigma and pressure of that stigma that very hard to go outside of the family and ask for help, or even within the family to express concern. And people start talking around the problem because it feels like to name it would be um, indicting the person with this problem, but also the caregivers and the family around them are sort of guilty by association.
It almost sounds like there's an element of cognitive dissonance during that phase where you're sort of negotiating with the different thoughts and perceptions of where this is going or where it may lead, and the circumstances that may lead to everything just getting reframed with a new lens, as you just put. But does that period set families up to blame themselves later because they look back and wonder, like, what did I miss? Look what we excused, what we behaviors we permitted. What should we have controlled sooner?
Yeah, I mean, I think any time, whether it's a substance use disorder or a psychiatric problem or other really bad habits, let's say gambling, et cetera, anything along those lines, behavioral problems, certainly parents end up looking backwards and going, okay, what just happened here? Like, could I have averted this? Like, was this inevitable, or did it have to do with that one time that I did this or that, or that vacation we took and I allowed them to do things I wouldn't have normally? And you sort of like try and make sense of it. I think the human brain is always trying to make sense of, like, where's the storyline? How do I make sense of this situation? And so it's quite natural to be doing that. At the same time, it's quite detrimental to spend a lot of time in the past in regret, in worry, in doubt, in self incrimination of what I could or should have done differently. And depending on the circumstance, some people are more likely to dwell there than others, depending on how much responsibility you felt in the past, how much responsibility you feel now, how bad it has gotten. All those things like influence how much people are really getting stuck in the past instead of moving forward and like, okay, what can I do differently now?
While all that thinking is going on, though, the family caregiver can also start becoming the investigator, the banker, the crisis manager, the peacekeeper, the person who's absorbing everybody else's emotions. And how does addiction slowly replace the ordinary role of the parent, spouse, sibling, or adult child?
Yeah, I mean, I think what you're describing of the different roles is exactly what happens, is that the caregiver ends up taking over all of those things because no one else is doing it, because the person who's increasingly consumed in a substance or alcohol is lost, is absorbed. And so there are needs of the family, of the relationship that continue on. And so, yes, the caregiver is taking over in all these different ways. And when you have one hat is like, I'm the banker, another hat is I'm the, parent, I'm the uh, cook, I'm the person who checks the car, is, up to date, and like if you are carrying more and more different roles around, the overwhelm increases obviously, but also there's less and less intimacy and fun that might be involved in the relationship, let's say in a peer relationship, siblings, partners,
Hmm.
spouses, etc. Like there's less and less of the sort of connective tissues of intimacy that really help relationships bounce through difficulties. So if we're having to do all of these, really focused, administrative, responsibility focused activities as a caregiver, we're getting less of the sort of juice and refilling of the tank that we need in order to feel like we can be resilient through these difficult times.
I mean, a lot of that applies to a lot of caregiving scenarios that we hear of. But how does a parent, spouse, or sibling, or even adult child know that they've crossed that line from loving someone into living as the emergency response system for that person's life who's living with addiction?
Yeah, I mean, we have very dangerous substances in the world right now. And, that's always been true. People have always, overdosed. There are very famous people that are out in the world who overdosed many, many years ago. So it's not like there's some new substance problem, but there are new substances and they are lethal. And when you are a caregiver and you realize that that's a risk that your loved one is taking, then it's natural to have the concern that this is something you should be paying attention to since they are not, apparently. And so, it would be different if you had a loved one who was using substances and coming home and saying, I'm going to be sure and bring my Narcan with me because I do want to be, I can't stop using right now, but I'm going to make sure that we don't die. My friends and I don't die when we're in the process of using. That would be a very responsible person in a certain way. It would be still risky, but usually somebody using substances, part of the deal is that there is such a compulsion to use for all the reasons. It might be obliterating the negative internal experience that someone has that they're trying to get rid of. They're trying to escape some kind of psychiatric issue. Lots of different reasons that people develop these problems. But for whatever reason, the compulsion is so great that the downsides are really minimized, both intellectually and practically. So they aren't walking around with Narcan necessarily. So, of course, the caregiver is starting to take these things more seriously. And honestly, I think the caregiver is in a clearer state of mind to be thinking about the possible downsides, the possible risks, etc. So I don't think someone ever stops. There isn't like a dividing line. I'm loving this person and now I'm the emergency response system. I think the two go hand in hand. There is an emergency response urge because you're still loving the person and because you're worried and you have more sort of cognitive resources because you're sober, that you're aware of the risks in a different kind of way. But it doesn't make it like a fun experience to be constantly aware of risks that your loved one seems to be not taking as seriously as you are.
Well, between that and just all of the newly assumed responsibilities and roles and hypervigilance, and then that emergency role that becomes a hat that's probably worn more often than not in terms of just being on the lookout for what could be around the corner, you can understand that many caregivers just feel exhausted, angry, terrified, and guilty all at the same time, and yet feel ashamed for feeling that way. I mean, why does loving someone with addiction create so many conflicting feelings all at once?
Well, I I think that there's a lot of explanation around the way our culture at large thinks about these issues. Because if we thought about substance use disorders as a medical problem that had a medical solution and um, and there were treatments available that people felt like they could go to without being condemned and critiqued on a moral failing level, I think we'd be in kind of a different scenario. I think it would not be the kind of conflicted environment that caregivers find themselves in. So if I'm a parent with a teenager smoking pot and I don't know what to do about that, I might talk to the pediatrician, ask them. They might tell me, go to Al Anon. You should, cut off their money. You should let them hit bottom. There's all sorts of actually completely opposite pieces of advice that caregivers are given. You should have an intervention or you should let them hit bottom. There's like these vastly polarized responses that society and individuals that are meant to be helping caregivers um, give that advice that are so different. It's pretty confusing. And it ends up, I think, for caregivers feeling like maybe this is on me. Maybe I created this. In fact, many times, professionals end up, I'm sorry to say this as a professional myself, but I do hear these stories all the time that caregivers feel like they were actually directly told that they were at fault, that they should be doing this or that or the other thing. So there's a lot of pressure on caregivers to feel like they are responsible. And so there are all these conflicted emotions that you're describing and that make a lot of sense based on all the pressures we've been talking about so far. Like those feelings get intensified when you feel like it's all on you and likely you did something wrong to cause this.
Well, some of that controversial advice, which you might yourself argue is antiquated, um, kind of makes the caregivers feel responsible for the outcomes in an environment where really they didn't have the control to steer the outcome. Am I
Correct.
heading down the right line there?
Yeah. I mean, that's what I would say is that it is antiquated advice and it's very condemning of caregivers when they're really in a really difficult position that deserves a lot more guidance and support than we tend to give people in these situations. It's very painful to hear the stories that I have heard where caregivers are seeking out support and they end up getting a lot of blame.
So that's very different from the craft framework that you were an important contributor to developing and framing, and it's certainly very present in North America and I'm sure around the world. Maybe you could introduce the listeners to that, as I think it's a good that we get that sort of on the table, 'cause I think that's really important.
Yeah, sure. I mean, craft is an approach that is specifically designed to help caregivers. Which is an unusual therapeutic approach, right? You would normally have a therapeutic approach that's targeting the person with the problem.
Patient-centered, yeah.
And so this is targeting the caregiver. Like, what can we do to help you? So CRAFT stands for Community Reinforcement and Family Training. And it's been around a long time, has so much solid evidence that they don't even study it anymore. It's very well established research wise as being super effective. And when I say effective, I mean that it helps people to feel better, their well being improves, and it helps get the loved one into treatment. So those are two things that people really want, right? There's a disconnect sometimes with I go to ask for what do I do? My kid is doing this or my spouse is doing that. What should I do? And the answer is often like, go to a support group for yourself in which you'll learn how to take care of yourself. And really, I want to hear, how am I going to get this kid into treatment? How am I going to get them to agree to treatment? How am I going to try and reduce? How do I respond to them when they're upset or they're telling me they're going to use again? Like, what words do I use? And so those kind of support groups aren't going to help with that. But craft is an approach that really does address that. So the approach I use actually is called the invitation to change approach, which pulls from craft and acceptance and commitment therapy and some CBT and motivational interviewing. A lot of gobbledygook psychology words, but basically the invitation to change approaches pulls from those strong research supported therapeutic models and specifically is targeting the kinds of things that parents and spouses usually want to hear. What do I say? How do I say it? What am I going to do to manage my own unwellness in this process so that I can be a better caregiver, so that I can, manage this crisis situation? So I think it's important for people to know that there are alternatives and there are things that they can do that are very concrete and actionable.
I mean, when you love someone and that person's living with addiction, rescue can feel like the most obvious form of caregiving. But why are love and rescue not the same thing?
Yeah, I mean, rescuing, if you have somebody who's standing on the edge of a cliff, you want to pull them away from the cliff, and we would call that rescuing. But if the person is, getting into their car with, a glass of wine or weed or whatever it is, are you going to take the keys away? Do we call that rescuing? I think rescuing can encompass a lot of different things. And what we don't want is for caregivers to walk around 24/7 feeling like their only role is to be following around and putting bubble wrap around their loved one to try to control what is not within their ability to control. Why do we not want that? First of all, it doesn't work. People don't respond well to that kind of effort around controlling and rescuing. But secondly, you're eviscerating your own life. You're throwing away your own goals on a day to day level, on a macro level. So we don't want people to be constantly in the role of rescuing. But I do think that there's a place for that. I work with a lot of families, and parents will tell me, well, I simply can't allow X, Y, and Z to happen. That's a mortal risk that they could be in a lethal situation. And so in those situations, yeah, we are talking about how to rescue. We are talking about how to be in a position where you are preventing really potentially lethal situations to occur if you can. Can't always do that. And in most situations, you can't adopt that as a way of life. It's just not effective.
Do you think that rescuing actually becomes the caregiver's way oftentimes of just calming their own inner terrors, even when it may not actually help the person they love?
Yeah, so there are many situations where I think that caregivers end up so terrified about the risks being taken that regulating that emotional experience is really challenging. And the
Understandably.
increasingly uh, the increasing challenge of that regulation causes them to do all sorts of things that are not helpful to them or anyone else. You know, staying up all night, for instance, waiting for their loved one to come home, or worrying about whether or not they're going to come home, or tracking them on their phone, etc. None of those things are increasing the health and safety of their loved ones. But it's pretty tempting to do when you're filled with anxiety, and doing something, even if it's just worry, even if it's just ruminating, feels better than doing nothing. And oftentimes people can't sleep anyway during that. So that's that's an example of figuring out how to assess what can I do, what's under my control to do, and that's a question of like, how can I have an influence? But it's also a question of how can I have an influence over myself? How can I make sure that tomorrow morning, no matter what is in front of me, I'm actually going to be resourced enough to be able to do something about it for myself, for my family, for my loved one? And what does that look like? Does that mean taking a hot bath and meditating and calling a friend, or, playing a stupid game so I can distract myself? Is it kind of self regulation stuff? Or maybe it is like getting in my car and going to get them and bringing them home. That might look like rescuing, but it might be the best answer if that's actually going to help the situation. If you know your loved one will get in the car with you when you get there, that's different than you knowing in your bones, if I get there, he's just going to scream at me and this is all for naught, anyways. Then that's an example of an individualized variable that really impacts and influences whether you take one path or another.
I really hear influence as being a big word, a big driver of the framework here.
Yeah.
Correct me if I'm wrong.
Yes, absolutely. I mean, because control just isn't a thing we get to do with other people. And sometimes we wish that we could, but it's not a long-term strategy. It's might be a short-term emergency cutoff valve, but it's not a long-term strategy. Long-term strategies involve really shifting dynamics and increasing healthy habits over time. And they're about small behaviors, changes. They're about reinforcing healthier behaviors, healthier relationships, healthier communications. It's like a lot of small pieces adding up to a larger wave of health.
It sounds like a fertile ground for individuals with addiction who want to take a stride to actually feel that it's a place where they can actually initiate change.
Yeah, I mean the thing that happens with substance use is that when you're really deep into problematic behaviors, it's very hard to imagine how it would look differently. You feel really stuck and cornered. And so the family does have the ability to be kind of a beacon of like, this is what healthy behavior looks like. It looks like this, and we're going to invite you sometimes to it. And it looks like this, and we're going to keep doing those healthy behaviors. We're not throwing our entire lives out the window while we're focused on you, the problem. We're continuing to go on vacation, exercise, make healthy meals, talk to each other in kind ways, elicit emotions, talk through problems, etc., as a way of being a beacon for like a healthier way of being. And that's quite meaningful. Role modeling is really helpful, and it's not necessary. Sometimes people think, well, isn't that obvious? Isn't it obvious that s- these ways of being are easier and better and healthier? It's not necessarily the case that it's so obvious, and it's certainly not the case that someone deep in a problem believes they can get there. So continuing to offer, invite, role
Include. Yeah.
model is super helpful.
Getting back to something you mentioned a little bit early, families who love someone with addiction are often told, don't enable them. But that word can really haunt every decision that a family caregiver loves someone who's dealing with addiction faces. So, like the money you give, the call you answer, the ride you offer, the door you open, is enabling really still a useful word in 2026, or has it become just too loaded to actually keep caregivers thinking clearly as they're trying to navigate all this?
Well, you're asking me, so I'm going to tell you that I do
Let's hear
think
it.
that it's really outdated, as I also think that the word codependency is outdated. These are words that I think make people feel really bad and make them worried, like we were talking about earlier, about having caused or created problems in the relationship, make them feel like they're sick for just caring about their loved one, that there's something maladaptive about that. And I think that it's really not helpful. On the other hand, sometimes I'll use the word enabling in the positive sense, like because there's often a of an understandable but overemphasis on the problem behavior. So we all understand that drinking a liter of vodka a day is a bad idea, bad for your body, it's causing all sorts of problems in the family, etc. No brainer. But the question of what would this person be doing if they weren't doing that? What are the healthy behaviors that we could enable? What could we invite this person to be doing? What could we support when they do it occasionally? When they do not drink one day or for even 1 hour, how can we support and encourage and reinforce those things? That is a kind of enabling, right? You're enabling something. But the way that our culture usually uses that word, I think just ends up making people feel responsible and bad in ways that are neither they or neither should be responsible nor bad about their loved one's behavior. And I think that refocusing to what are the positive behaviors that you want to see more of that would replace this thing, then I think those are really helpful ways to focus caregivers' attention.
I'm sure this has come up in your experience, but when a family member says, I gave them $40 for groceries, but now I'm wondering, am I enabling? How do you help them move past that sort of label and understand whether that choice actually helped, harmed, or changed anything at all?
Yeah, that's a great example because, yes, it does come up all the time that there's whether it's I gave them $40 or I paid their rent or I made them breakfast or I gave them a ride to work. Those are all things that I think the answer to whether or not they were healthy or unhealthy behaviors is what happens next. So you gave them $40 for groceries. Did they spend it on groceries? Do you know in your bones that they're not going to spend it on groceries? Do you have any reason to believe that they're really going to feed themselves with this money? Do you think that them keeping a roof over their head when it comes to paying rent or something is better for them because being unhoused is going to create all sorts of other problems? I mean, I think those are the questions that help you assess a decision and what you want to be doing moving forward is what happens next? What do you know? Caregivers know a lot. Caregivers know a lot about their loved one. They know about how they think, what motivates them, what their habits are. They have tons of information. And in the invitation to change approach, we use something called a functional or behavior analysis, where we really write out all the things the caregiver knows about their loved one's behavior, what motivates them, what do they think the consequences are? What are the situations that they're likely to use in? What are the situations they're likely to not use in? What are the healthy behaviors we want to increase? So that people really have a roadmap for understanding, okay, this is how I'm going to assess whether or not I want to give $40 for groceries. This is how I'm going to assess whether I want to pay for rent, is by looking at this kind of roadmap and thinking through, for my loved one specifically, not just people in general, what I know about my loved one, is this a good idea?
Can it start to feel like the recovery, relapse, or survival of a loved one really depends on what you as a caregiver do next? How do you help them separate what they can truly influence from what they just can't control? Is that where, in addition to that analysis, CBT comes in, where you really get people to reshape their thinking approach to the scenario? Can you expand on that? Because I know you alluded to several approaches that you use in your adaptation of the framework, but I think it's important for our listeners to understand that.
Yeah, so you're highlighting how to make decisions in the here and now, how to assess whether or not there's to me, I focus on understanding. So how do we understand what is the function of this behavior that we find so upsetting, right? Whether it's alcohol use, gambling, sexuality, whatever is being compulsive and negatively impacting the family, the relationship, how do we understand why this is happening? So we think of substance use disorder problems as a biopsychosocial problem. It's not just, genetic. They were always meant to be that way. We know that's not the case. There are plenty of people with big family histories of substance use problems that don't develop problems. So why is that? Because it includes all of these other elements. So once you have a better understanding of what the function of the substance use is, then you can focus yourself in a more productive way around kind of creating game plans for yourself around, okay, now I understand my husband is using marijuana because of anxiety. So I can educate myself about anxiety. I can talk to them about anxiety. I can think about what are solutions for anxiety, that I can then make a game plan about how to speak with him about that. That is sort of getting underneath the problem and sort of directing the caregiver's attention to the thing that could be most impactful. Having said that, there's a lot of ways that people can get derailed into focusing so much on problem solving that they ignore their own needs. And I think that's really the balancing act that we're always dealing with. How do I continue as a caregiver to pay attention to and take seriously my own needs and do what's under my control to do to influence change, and always balancing those two things. It's like the example of putting on your oxygen mask on the plane before you help your partner. That is not human nature. When you've got a kid sitting next to you or somebody who's disabled, you're going to help them first, right? Or some people might be might be their nature, but I think the reason why we have to say that to people on every plane that anyone gets onto is because it is important to remember to do that, and it's not necessarily your first impulse. And that gets played out in these kinds of relationships all the time. Are you putting on your own oxygen mask first? Because you're going to be a better thinker if you do that. You're going to be a better problem solver. Oftentimes when I'm working with caregivers, they don't really hear the rationale of just attending to their own needs as being the most important thing. They hear the rationale of like, okay, if I take care of myself, I'll be a better caregiver. That feels like it holds more water. Now, that might sound kind of distorted, but the fact is they've been living with a house on fire. So it makes a lot of sense that they say to me, as they often do, listen, I know how to take care of myself. I will do that eventually, but this is the real problem. This we got to take care of. We got to get him into treatment. Then yes, I can do all the things to take care of myself, which is understandable, but we want to try and shift people around so that they really take seriously their own needs.
Because that can just compound in itself as well. And then before you know it, there is no self-care and it's perpetuated. Then again, sometimes you pull down the mask, then, it almost sounds cartoonish, but you're holding the mask, then you see the oxygen line come down and there's no feed. There are all kind of variations to that theme. And it pops up in so many conversations. But when you pull down the mask, it almost symbolizes a sense of control. But can you tell us from your experience working with caregivers, why is it so painful that you can develop and even have influence, but you don't have the ultimate control over whether someone with addiction actually gets well?
I mean, I think it depends on the person, but I do think that when you care about someone, your fate is attached to theirs. And when you see them not taking care of themselves at baseline and maybe really risking their life, then you're going down with them in some ways. So it feels like a shared outcome, a shared fate. And you can begin to detach from that, as some people need to do. But I think most people get into relationships because they want to be linked. They want to have a shared reality, a shared future. And that's a pretty natural human wish. So, of course, the fates are going to feel linked and pretty important to focus on the problem and solve that problem, um, even though it's technically not under your control. It feels like it's having a big influence over your life.
Getting back again, that it really intrigues me because you touched on this earlier, but many families have been told to, detach with love or let someone hit the proverbial bottom. But when the person you love could die from use, those ideas can actually feel pretty unbearable, especially today when substances are, many instances, more dangerous than other. How does that reality change what it feels like to try to set a boundary?
So, a couple of things that come to mind with that question. I mean, first of all, there are these very obvious ways that there are high risk substances and, you know, potentially lethal outcomes. And then there are these slower burn problems that we're learning more about now. For instance, cannabis is legal in however many states now. Um, Even though supposedly you're not meant to be able to buy cannabis as a teenager, still in every state that passes it being legal, the rates of teenage use go up because that's what we're role modeling. The availability, access, all that stuff increases. So that use of cannabis at teenage years is linked to greater problems down the road in a variety of ways that we wouldn't necessarily anticipate in terms of executive functioning, in terms of increased risk of psychosis. These are things that it's not necessarily evident, especially for parents who have had their own experiences with cannabis potentially at a lower dosage level, intensity, et cetera. So their image of what that is quite different. So I use that as an example because there are ways that substances are now in the zeitgeist of our world that appear normal or part of normal adolescence, which are going to have a really negative impact for a certain number of people. And we can't predict that exactly, but it's going to happen. And so the parent that is coping with that is really in a tough position. How do they treat this like an emergency, treat it seriously, whilst the entire world around them is saying this is like kind of normal, it's legal now, these kids are doing this, it's not a big deal. And yet we know that there are these risks for kids. Is it going to be every kid that smokes weed that ends up with a psychotic problem? 100% not. But it is a bit higher risk. So it's a matter of like, how much risk are you willing to live with in your family, and what boundaries are you going to put in place? How are you going to communicate the importance of this and what your values as a parent are, while not making the kid feel like she's really out to lunch? Like that's all my friends smoke, so I don't know what she's talking about. Like, that is a really tough balancing act.
Well, seeing that if you start at 15, that's 10 years of brain development that still lie in store. And I think that's a big unknown. But
Absolutely.
at the other end of the spectrum, what do you say to a parent, spouse, or sibling who's so afraid that the next boundary they create would be the last thing they ever say to the person they love?
Yeah. Yeah. That's so tough. And that really the the approach that we use, the invitation to change approach, is really so useful for this very question, because you are paying more attention to the quality of the relationship, the way in which you're talking to each other, the words you're using, open-ended questions, attending to validating what you can, reinforcing the positives. You're really enriching the relationship in order to have more leverage when you need it in setting limits or boundaries or making requests, etc. And all of that makes you feel much more grounded in what you might say at any given moment. And to your point, when you set a limit and you know that someone might then go off and use something that is potentially lethal, you want to be really grounded in what you've been doing with them in the relationship. You want to have spent a lot of time thinking about your values and what matters to you most, so that if the most horrible thing that any parent can imagine does happen, they have a sense of, I I did what I felt was the most important thing to do. I focused on my values. I enriched the relationship in the ways that I could. I used all the skills that I could to manage this, and this is what I thought was the right thing to do. But they had a path, they had a rubric, they had a game plan that was really based in their own values. That was an action plan they could endorse. Of course, tragedy happens.
Mm-hmm.
That's part of these problems.
Is your adaptation of the craft framework over time actually reflected by the changes in the potencies and different drugs that are out there? I mean, has craft had to have been reinvented a little bit along the way to adapt for 2026?
So, what the adaptations that we made to craft were really designed to help family members have a greater awareness of what motivation is. Like, how do we understand motivation? What is the function of substance use? What is the nature of treatment in general? How do you think about treatment and fit that into what your goals are? Because oftentimes people have a a clear sense that their loved one needs treatment, but what does that look like? What are the options? If I have like one chance to get this person to agree to do something, I want to get the best scenario in place. And the way to do that is to think about what is motivating your loved one to use in the first place. What are the underlying problems so that we can sort of have a motivational hook, we would call it, that the person using substances would actually agree is meaningful and worth paying attention to. So if they think anxiety is the problem, then we're going to have a better chance of getting them into treatment that addresses that anxiety.
I read so many comments on our social media, and there's so much concern among caregivers in different domains about just the ability to self-care, or the system, the environment, the situations don't really create a permissive space for self-care for so many reasons. But here it seems to be and play an important place. But what does self-care actually mean at 2:00 in the morning when someone you love is living with addiction and they may not have answered the phone, or they may not have come home, and your body is telling you something may be terribly wrong, and every instinct is telling you, just do something?
So what does self-care mean in that moment? I think
What
that
can it be?
yeah, so I think it really depends on the person and the circumstance. And to me, one of the big pieces to incorporate into any answer to questions like that is compassion. Like, do you have compassion for yourself enough to be able to distract yourself? And do you have a sense of like, okay, I walk around in the world feeling in my bones like something terrible is going to happen. This is no different. It's 2:00 in the morning. It's 5:00 in the morning. It's noon. I always feel this way because my loved one is doing some dangerous things. That's a very different circumstance than like I woke up in the middle of the night and I have a really bad feeling. And that bad feeling is maybe based on sort of subtle things I've noticed over the last week and the shifts in their behavior. And it actually is information that I should act on, that I should text them or call or do something right then and there. That I think is about really assessing. That's a self assessment, right? Asking yourself, okay, what's happening here? Is this how I always feel? Is there something different about this? And how, to me, an action plan is self-care, because you are figuring out what can I do in this moment that's going to be helpful, and what do I need? What is my body telling me that I need? Is my nervous system completely shot? And really what I need is to get into a hot bath or a cold shower, like shock my body into feeling differently? Or do I need to like cuddle with my partner? Do I need to get some oxytocin to like calm my body? Or do I need to actually do something? And oftentimes the doing isn't really the answer, but sometimes it is. It really depends on the person and the circumstance and how you're assessing for yourself. I know what the situation is. Have more information than anyone else about the situation. So let me ask myself, what are the variables? Is there something that I should do? People don't always know the answer, but oftentimes there are some answers in there if you just pause and breathe and ask yourself.
So, invitation to self-explore those moments and find some things. We're going to take a little break, folks, and hear from our illustrious production team, who always have a couple of good questions for our guests.
One of the things that we've been sort of talking sort of a little bit around in terms of the word influence is, I think, cultural influence and the impact that the broader culture is having on addiction. We've seen, obviously we've seen smoking and alcohol use be normalized across films and television. glamorized for sure. If you've been watching sports lately, all of the sports broadcasts have been taken over with gambling promotion. They're now giving you the odds, in the break so that you can make those bets. Pornography, we've seen it also explode and become normalized. I think it was Pornhub that did a mainstream advertisement campaign on television. I think it was Thanksgiving a couple of years ago. That's come out and it's all over social media. So how does culture itself impact these issues in terms of just opening up the doors and inviting people to come into potentially incredibly addictive, I guess you could say they're addictive products or addictive behaviors. And is that treated differently in your profession than substances are?
Great question. Big question.
Big question.
So I think that everything you're describing is super important. In my field, what we are anticipating, unfortunately, is a tsunami headed our way in terms of gambling. It is profound. What you're describing of, many people have been watching basketball, soccer, all these things, and it's everywhere. You can't avoid it. And, kids are seeing this, kids are absorbing it. Forget about that. You also have like video games that are gamifying gambling and bet on this or bet on that. It's embedded in video gaming now, this gambling sort of way of thinking and integrated into their games. So it is completely being normalized. And I think it's only a matter of time before we're going to see like a huge problem. And the thing about gaming or gambling is that it's sort of invisible to the rest of the family until it's not. So there can be a huge negative impact that is just like slamming into a brick wall, that you really don't see it at all. Maybe the stress is increasing and you're not sure what you're seeing. Why is he so stressed out? What is happening here? Like, why is he so worried about this game on, that kind of uncertainty, but you're not seeing them intoxicated. They're not disappearing places. They just seem distracted a lot of the time. So people don't even know what they're looking for and they don't know what they're seeing. So then a big bet is lost and like potentially really big problems are impacting the entire family. So there is no question that this is coming for us as a society because we've opened these doors in advertising, social media, all the things you're describing. So how do we deal with that? I personally feel like we are not at all prepared for how this is going to impact our society. And I fear for everyone at large. I feel for kids developing this idea that this is normal. And I think that to get ahead of it, we really need to be paying attention, really noticing how, like, for instance, I used to talk with parents about, like, just be aware of how you talk about your stress level and what you describe as needing at the end of a day to take the edge off, right? So it used to be that parents would come home and say, oh, I need a drink, or, oh, I'm going to go, smoke. I'm so stressed out. And they would role model that for their kids over and over and over again, and for themselves. That was the narrative, the internal narrative. So that's still important to notice as a parent and to be attentive to how it is that we're role modeling managing stress. But there are other things that we're role modeling about, like placing bets on things or guessing, what is this going to be? What is that going to be? Oh, you want to put money on that? That's a sort of part of our culture now in a way that is really accelerated recently. So I think we can be much more attentive to those things in our vernacular, just casually, but also publicly, and in our social circles, like really. And it doesn't have to mean that it's completely off limits. No, we don't place bets in our family, but to just talk about it, to talk about it critically. Wow, I don't feel like we used to bet on games in the past. Like, are you guys betting more? Like having more of a dialogue about it out in the open so that it's not completely hidden. Because right now, I think a lot is hidden, and that creates more potential problems down the road if we're not talking about it openly.
Just a quick follow-up to that, though. Do you think that increased propensity to gambling addiction is just about the dopamine fix, or do you think it's actually evolving in a much more complex way as a mechanism to deal with collective angst?
Yes, all those things. I think that it's really complex. Like right now, as we're sitting here, my phone is buzzing. So my phone is next to me all the time. As a therapist, I try and like hide it places while I'm in sessions. But it's really addictive. It's addictive. It's like the place that I read my news. I am in touch with friends. I hardly use it to communicate verbally, but it's everything else. And there's an impact of that. There's a real impact. And I think that it is changing the way we use technology and how we relate to each other, how we relate to getting a fix, having that dopamine hit. Absolutely. But I think there is something that's changing in general.
Yeah, I think so too.
Graham, did you have something?
Yeah, I was watching one of the FIFA games in a bar in Toronto here. And in some of the bars, in the bathrooms, they have these screens that display different advertisements. And as I went to use the bathroom, I was sort of disgusted when I saw that 3 out of 4 of the rolling advertisements in a tiny little 8x8 bathroom are rolling gambling ads every time. It's impossible to get away from. It's everywhere, especially I'm 29. I'm squarely in the demographic that is being constantly targeted by these advertisements, and it's suffocating. Further, you touched on something earlier in the show, which was that cultural effects and your peers really have quite an effect on what the culture is of substance use, or what's normal in your society. I came from somewhere where recreational drug use and heavy drinking were quite normalized, particularly party drugs like ecstasy or cocaine. And as I've come into my later 20s, I've struggled a lot with watching friends of mine sort of go deeper down the hole of using these, what was once fun drugs for them, and drinking a lot more. And it really sort of taking over them. And time again, I've seen having these conversations or broaching these subjects with people I know that may have an issue can really tarnish the relationship that you have with them, especially if it's a close friend, because that sort of puts them in an out group. It alienates them. Or, maybe when you broach the subject, they may reply with a subdued response when they're on a come down or they're hungover, and they say, yeah, I do really have to lay off of the booze or stop doing so much cocaine, but then no change is really ever made. So my question is really, how does one navigate bringing up an issue like this to a closer friend? And how do you balance letting them know that you're there to support them and you don't want to cause any guilt or shame towards them, but you also want to let them know that, you don't want to see them putting themselves through something like this anymore?
That was lovely.
Thank you.
You can say that. I mean, I think it is. I'm serious. Like, I think being able to share really directly about the observations you have and the worries that it gives you and the ways that you want to be available to them and that you care about them and have you don't have the wish to make them feel worse or feel ashamed or something. Like, I think being able to talk about it in a non-shaming way is really a skill, and it's one that you can get better at over time as you're practicing. But the other piece that I think beyond conversation that is really helpful in a peer group and a friend group is activities.
Mhm.
Is your friend group going to, not you particular, but is one's friends group going to the bar? That's the main way that they hang out. Are you going to play a game, of soccer? Are you meeting to play ping pong in the park? Are you going to an amusement park? Some of those activities are much more conducive to having a drink or using substances than others. And you sort of um, you steer around the problem by just going directly to what is the healthy behavior we would be doing if nobody wanted to drink?
Mhm.
What would we be doing?
Mhm.
Like, if nobody wanted to be high, would we go to the climbing gym where you really can't be high and be effective climber?
Yeah.
Um, or would we, go hang out in the park and drink? Like, thinking through together as a group, maybe directly, like, we're all like in this situation where we're hearing, I don't know about you guys, but I'm attentive to this kind of thing. I see articles all the time about how alcohol is not healthy for you.
Right.
We used to have all of these different myths about how red wine is really good for your heart, actually. And, French people don't ever develop problems and all that kind of stuff. And we now understand that that research was flawed in some particular ways and can see that alcohol is a carcinogen. A carcinogen. It is clearly something that's going to cause problems in your body. So you can drink this much or this much. You're causing problems. So that is not something that we've always understood clearly from the science, and it's certainly nothing that the broader culture has promulgated in terms of an understanding of what's healthy. So I think there are lots of things that you can do in terms of the activities themselves that can be super helpful, just like orienting yourselves. Because and it takes some creativity and effort to do it because our culture is really, I live in the city in New York, and in Manhattan, the apartments are this big. So
Mhm.
people are not socializing in their apartments. They're going out. Where do they go? To a bar, because those are the places to hang out, right? Or to a park or what have you. But you have to work to get an activity that is not focused on the central substance of choice. And that's a cultural problem. That's a larger problem. And acknowledging that it's a larger problem is helpful because it takes less pressure off of the individual and helps us all remember, like, okay, we're role models for each other. We all are little instruments of culture, but there's a larger sort of pressure at play here.
Mhm. Mhm. Well, I appreciate it. Thank you.
We're back from a really interesting discussion with our production team and our guest, Dr. Nicole Kosanke. Nicole, can you tell me, as time goes on, families often describe with repetition, they describe addiction as almost becoming a kind of grief, even when the person they love is still alive. I mean, what happens to a caregiver when they look at someone they love and they see the addiction first before they can see the person they used to know?
It's so painful, really painful to have that experience of an addiction clouding the personality and the relationship that you once had. And over time, that can happen more with some substances than others, maybe because of how much it impacts the personality. And some things are more prone to be physiologically create physiological dependence. So there are different ways that this plays out, but I think that what you're speaking to is the psychological impact of grief and loss. And like we were talking about before, that people are in relationships, they tie themselves to each other, purposely because they want to be united. They want to have company in this life. And so to begin to see their loved one as more of a problem and the negative aspects of who they are when they're using are more prominent than the positive aspects, it becomes more and more painful. And understandably, people turn to others or other things, other activities, other ways of soothing themselves outside of the relationship to sort of manage the loss of that and the loss of the intimacy. So you might have increased attention with friends or having more focus on hobbies or activities because you're really lost out on the gifts of the relationship that you used to get.
Are there, and I'm sure they exist, sad stories of where caregivers turn to addiction themselves?
Oh, sure. I mean, I think one of the things that can feel so painful is to recognize that your loved one is really in a bad way with a substance. And yet there's a feeling on the part of the caregiver that at least they get a break. How come they get a break and I don't get a break? And so that can lead towards a caregiver ending up using the same kind of way or leaning into checking out with a substance, which is pretty understandable.
It's an
There's
easy cognitive trap for sure.
yeah.
So when a family is caring for someone with addiction and they've tried all the tools, they've changed their own behavior, they've stayed connected, they've tried to be positive influences and setting boundaries, what do you tell them when the person they love still doesn't enter treatment or get better?
So, first of all, treatment isn't synonymous with getting better. Like it's not the end all be all. It is
Good point.
helpful. I obviously think so. As a treatment professional myself, I believe that it's helpful, but it's not helpful for everybody. It's not everyone's cup of tea. And many people, in fact, most people with substance use problems, the research tells us, they have what's called natural recovery. They don't enter treatment, but they do get better. And I attribute this to, you know, family and peer relationships that people support each other and find ways to get out of the problem just as they got into the problem in a unique way. They find their way out of it in a unique way. So I think that, I believe treatment is helpful, but it's not for everyone. But when people don't get better and you've done everything you can, I think the question for peers, like a friend or a sibling or a partner, the question, of course, is on the table. Like, are we going to separate? How long do I wait for this? And that's a very individualized answer, how you grapple with that question. But the question is there. And with a parent and a child, maybe when the child is older and an adult and, there might be psychiatric issues, et cetera, there are circumstances where that question is still applicable. But for most parents, they're not even entertaining that question. So I think, but in different relationships, there are different options available. And I think it's important to recognize that, to be honest with yourself and with other people about that as a possible outcome, that there might be divorce. We might be estranged. That might just be the way our relationship goes. And I will know as a caregiver that I've done what I could do. And that, I think that's also a part. The person, Bob Myers, created the craft approach, and we used to do trainings in which he would describe some of the examples of success, and some of them for him were caregivers who decided to leave their husbands or decided to have an estranged relationship with a family member that just wasn't repaired. And that was a success story because they learned how to take care of themselves and they ended the pain for themselves. And the other person may or may not get better eventually, but they did what they needed to do. And that approach allowed them to feel okay enough about what they had done and what their efforts were, and that they had put their best foot forward in a way that allowed them to then decide, okay, I need to be done with this relationship, and that's okay because I'm in a solid place myself.
Do you think it's the realization that as a caregiver, you're truly disappearing, and that is one of the biggest signals for making a move for change?
I mean, it can be a really positive impact on a substance using person at times, not always. But if you're in a situation where you really don't think your partner or the people around you are ever going to leave, like they just always come bouncing back and they make a lot of threats, but they don't really follow through on them. That's one of the things that we really work with caregivers around is like, do not say that you're going to set a limit and not follow through with it. Be really careful about what that limit is that comes out of your mouth, because what we don't want is to breed, like erode your sense of leverage and ability to be reliable, basically, around your words. So if you're going to say something, you want to be able to follow through with it, which might mean that you don't set limits for a while because you have to figure out what you're really able to follow through with. But if you're a person that you don't really believe that people are going to follow through with things, it can be quite a shock when people actually do. And that sometimes has a positive impact on the behavior patterns because it shocks them into, changing for the better.
But how do caregivers in those scenarios avoid seeing themselves as failures when the person they love continues to use and doesn't get better or doesn't choose to get better?
I mean, I think part of this process that we're talking about, all these different tools that people have with craft or invitation to change approach, like there are so many pieces of it that attend to what the caregiver's values are and what's really important to them and how they can build on that and have a roadmap that's really uh, aligned with their values. And that all leads to less guilt because you're really clear about what's important and what you've done and what you can control and what you can't. So that when you're really clear about that, there isn't a sense of overextending your boundaries to be responsible for all this stuff over here. You're really more clear about what you're responsible for.
And further defining the language of self-preservation so our listeners can really understand. Can you just tell me, when is leaving the caregiving relationship truly the healthiest decision? And can leaving in itself ever actually be an act of love?
Yeah, so we were just talking about examples where that leaving might be really helpful to the loved one. I think that you're in a you can only make a decision like that when you feel really clear for yourself. If you are making a decision to leave someone because you're hoping they're going to change and that will finally you'll finally realize how important it is, that is not what I recommend be the motivation. If the motivation is that you have had enough, you are estranged, you don't feel connected in the way that you want to feel connected, then that's an indicator that it's time to think seriously about this. And if it's gone on X amount of time, if you've set up plans for yourself, if this line in the sand gets crossed, I'm not, I'm not going to stay in this relationship. If this is still going on at this point in our lives, I'm going to leave. If those things if you keep saying those things to yourself and you keep crossing over them, or your loved one is crossing over them, that's another indicator that it's time to have those kinds of hard decisions come up and be debated.
As caregivers are working through those thoughts in their head, how can you help a caregiver tell the difference between abandoning someone they love and refusing to disappear with them?
And refusing to disappear. I mean, I think that part of what we're talking about is that relationships are really impactful. They're really impactful. And that's the power. There's great power in relationships and influence, and people who care about each other want to help each other. And you're not going to erase that by leaving the person. So sometimes what we talk about when we're working with someone using substances is, can we take a break? Can there be like a period of abstinence that we just experiment with how it feels, what it's like, what skills are required to get it done? And that could be a week, could be a month, could be longer. But with the loved one, with the caregiver, we can do something similar. What would it be like to really take a break from caring, doing the caregiving in the way that you've been doing it for a week, a month, a day, whatever it is that the person can manage? And it isn't about stopping caring. That's not usually on the table. What's usually on the table is, could you stop making dinner every night? What would that be like? Can we start to envision what it would be like to not be always the one that's in charge of all these 8 different hats you're now holding? So that's a kind of sort of experimental attitude that can be really helpful, because you try something on for size. How does it feel? Does it feel liberating? Does it feel frightening that I'm losing my role in the relationship? Does it feel like I'm abandoning them? Are they telling me that I'm abandoning them?
Mm-hmm.
Like, it's very one situation to the
feedback, right?
next is going to be different. So you want to sort of experiment and help people expose themselves to what it would be like to make some changes.
After more than 2 decades of working with families affected with addiction, what do you wish every caregiver truly understood about loving someone they can't control without losing themselves?
So I think I said this before, but I feel like compassion is such a huge element of importance. There's a new book called Fierce Self-Compassion. What is it called? What's the name of that book? I'm forgetting the whole name, but this idea that self-compassion is quiet, is passive, I think is only one part of what self-care looks like. And the other part of self-compassion is really having good boundaries, being able to be assertive, having clarity about what your values are, and being willing to fight for them, being able to have compassion and understanding as an action plan, not as a platitude. So for me, I think caregivers really benefit from having that game plan, having that map in for themselves that includes what's really most important to them, and having a sense of compassion for their loved one, but also compassion for themselves. So much so that they're willing to fight for themselves, and they're willing to fight for things that matter. And sometimes that's about being assertive with language. Sometimes it's about setting a boundary, setting a limit, but it's all wrapped into a sense of, we are human beings. We make mistakes. We influence each other. We can have a positive impact. And let's try and be purposeful about what our steps are that we're taking.
I think that's a wonderful definition of self-compassion, or expansion of what perhaps we might be used to thinking is that sort of putting your arm around your old shoulder and saying, it's okay. It's not great and it's not working out, but just being kind to that person experiencing that. But this is more to it than I love it, actually. It's like, no. I have a role towards myself that involves active choices, active self-determination, active agency. And my act of compassion to me is actually embracing those active processes as well as the passive. Wonderful. Yeah. I think that's probably one of the most inspiring things I've heard in a long time. And I think it really befits a conclusion of a wonderful conversation today that really took us places that we're not used to going. I thank you so much for joining us. This wraps up this week's episode of the Caregivers podcast. I'm your host, Dr. Mark Ropoleski, and we'll see you again next week.
Thanks.
Nicole, thank you for helping us have a conversation that so many families live every day but rarely get to say out loud. I think one of the clearest reminders from this conversation today is that addiction does not only affect the person using, it can reorganize an entire family around fear, broken trust, rescue, guilt, hope, and crisis. And for the person trying to help, one of the hardest truths may be that love matters deeply, but love is not control. That doesn't mean that families are powerless. It does not mean they stop caring or stop hoping. And it does not mean every family will make the same choice about staying close. But it does mean the caregiver's life cannot become the price of someone else's recovery. For anyone listening who loves someone with addiction, I hope this conversation helps you feel less alone. I hope it gives you language for the fear, guilt, anger, grief, exhaustion, and love you may be carrying all at once. And I hope it reminds you that protecting yourself is not the same as abandoning the person you love. You can love them without disappearing. Before you go, please subscribe and follow the Caregivers podcast wherever you're listening or watching. It's free, it helps support the show, and it helps these conversations reach more caregivers and families who may need them. And if the Caregivers podcast has been helpful to you, please consider buying the team a coffee. We're a new independent show, and every bit of support helps us keep bringing these conversations to caregivers each week. The Buy Me a Coffee link is in the show notes on YouTube, Apple Podcasts, and Spotify. Thank you for listening, and we'll see you next time. Before we wrap up, I wanted to remind you of something important. The conversations you hear on this podcast are here to inform, to support, to spark reflection. They're not a substitute for professional medical advice, care, therapy, or crisis services. Listening to this podcast does not create a doctor-patient or caregiver-client relationship between us. If you're facing a medical concern, health challenge, a mental health challenge, or a caregiving situation that needs guidance, I encourage you to reach out to a qualified professional who knows your story. If you're ever in crisis, please don't wait. Call your local emergency number or recognize crisis hotline right away. You deserve real-time help and support. The views you hear on this show, whether from me or my guests, are our own. They don't necessarily reflect any organizations we work with, or are part of, or have worked with, or been part of in the past. This podcast is an independent production. It's not tied to any hospital, university, or healthcare system. Thank you for being here, for listening, and most of all, for taking the time to care for yourself while you continue to care for others. I look forward to hearing from you.